All right. So, friends, how the preparation is going on? Deepika, Sanya,
Yes,
Suzanne.
yes, ma'am. I'm trying hard, but patience in between
All
patience
right,
skills.
Ruchi, thank you so much for joining. After so long, I'm hearing you. Okay, how preparation is going on? Please tell me.
Yeah, ma'am, doing it between the OPDs and OTs and managing
Yeah,
kids as
yeah.
well.
It's quite normal to do with all these things, but I can see that in the night time and in the evening, you people can consume a lot of hours in studies, right? So what I suggest is that more than 10 stations per day should be done along with full preparation. Not like actually people are joining, so just give me a few sec to join to start. Uh, okay, because you know that to do 10 stations in a well prepared manner are very, very important. Not like this, like half heartedly prepared, and we are going to start them and practice with our study, but it's not like this. Those 10 or 12 stations should be fully prepared, and then you should discuss. Without full preparation, there should be like, it's not beneficial to discuss, right? Okay, so I will not waste you a lot of time. So I will start with the new recalls, right? I have gathered a lot of information for you guys, that exact questions from the role players, right? And exact answers from the scorecard as well, right? So I am here with all information. Please open your notebooks and write all the passing points, because to prepare a station is not a big task if you are preparing it in a half-heartedly manner, one third or two third of the station. But to cover a station complete from head to toe, to cover all domains in 100% passing manner, actually this is basically the aim of just a minute, let me enter a few people. Yes, so this is basically the aim of session, that the station should be 100% passing station. If these stations will come in your exam, these will be 100% passing stations. And after this session, you will pray and you will, this will be your biggest desire, that these stations will be coming in exam, right? uh, Yes, can somebody please message in the group that Rekha is asking about the class has started? Rekha, you are not in the class. You are in class, I think so. Rekha is not here. Yes, she is not. Just a minute. Okay, so let's start with the very, very first station. I think that this station has never been discussed anywhere. This is what about my idea. Let's see. So please, can you tell me the slide is changing or not? I do not want it to change actually.
No, ma'am.
It's not changing, right? Thank you, Suleikha, for joining us, my dear. Let's start. We are just starting the session. Who will start the timer?
I'll start it, ma'am.
Okay, Arnav, thank you so much for joining us, my dear. Let's start. And just a minute, let me bring the station out. Where it is, it's here. Okay, let's start the timer. Who is going to present, please? May I know the name?
Ma'am, may I present?
Me
can. Yeah.
Anyone, you people will decide that who is going to present. Isaac, thank you so much for joining. Okay, all right. So please start. Who is going to start?
Suzanne. Suzanne, look.
Suzanne. Okay, all right, Suzanne, please go ahead. 2 minutes start now.
Everybody mute.
Thank you, Rajini. Please mute yourself. Suzanne, you are doing right?
Yes, ma'am.
Okay, all right. Suzanne, please take your 2 minutes. Yes, Aparna, definitely. Any one of you can do, please. I don't know exactly because names are not visible to me. So anyone will start. Hello, Ayat. Thank you so much for joining, Ayat, my dear. Ayat, actually, it's part 3 session, my dear.
Yes, only slide, ma'am.
No problem. Please take your time.
Some value of TFT is not written.
Yes, it's normal, actually. Please let us know when the 2 minutes will complete.
This is only slide?
Yes.
Okay.
2 minutes is good. Yeah.
Okay. Start, please. Start, Suzanne.
Yes, ma'am. Hello, I am Dr. Suzanne, one of the doctors in the Gynec clinic today. Can I confirm your name and age, please?
Yes, doctor. I'm Ashley. I'm 21 years.
How I call you?
Ashley is okay.
Actually, I gathered from your notes that you have some concerns about your period. That's right?
Yeah, yes, exactly.
You have any other concern?
Yes, actually, I have a lot of things to discuss with you, doctor.
Yes, of course. You can.
Mm-hmm.
Please, if you have any other concern.
Yeah, doctor, actually, I'm in a new relationship with my partner, so I'm looking forward to have like extending my family as well. So, and I'm not having periods from last almost 12 months. So I'm quite concerned that if I'm not having periods, so how it would be possible and I will be having a baby in the future. So this is quite concerning for me.
Okay, I will address your concern and what for you the management plan. But I want to ask you a few questions before I start. That's okay
Yeah,
for you?
sure. Yeah, sure.
Ashley, can you tell me more about your period?
My weight is actually, I have done in last 10 or 15 days. It was approximately 17 BMI. My weight was 17 or 17.5.
Your last menstrual period.
It was, as I have told you, that I have not bled for last 12 months. So it was almost 1 year before.
Mhm. Okay. You have any, before that, you have any problem in your period?
No, otherwise, like they were coming after 3 months or 4 months sometime. But I was like happy that it's okay if the periods are not coming because as I actually participate in tournaments and I'm elite in a sports women. So I was quite happy that if periods are not coming, so it means that I can participate in my activities like very, very efficiently. So I was not bothered by it. But now my partner is saying that we should have an extend our family. So this is right time that I'm concerned about my periods actually.
Did you take any medication for that?
No, I have not started anything.
Do you notice any hair growth in your or acne in your face?
Not exactly.
Okay. Do you have abnormal bleeding or abnormal pain in your tummy down below? Any period?
Pain in tummy? No, not at all.
Personal question, please, Ashley. Can I ask?
Yes, sure.
You told me now you are sexually active at this time and you want to get pregnant. That's right?
Yeah, exactly.
Okay. So you have any problem during sex?
No problem at all. But yeah, I am having just my tournament in next 3 months, so I'm quite excited to go for that as well.
Okay. You have any other medical condition?
No, not at all. My GP has done some test for my thyroid gland, and she told me that it's fine.
Yeah. Okay. I can see that. You have any surgery in your tummy or down below?
No.
You have any allergy?
No, I'm not allergic.
Any family history like this condition in family?
No, not any particular.
Any history of diabetes, hypertension, thyroid problem?
No, nothing at all.
Okay. Do you aware of your, you tell me your body mass index is, your weight to height ratio is 17. That's right?
Yeah, it's almost fluctuating between 17 to 18 sometimes, right? Because you know that my trainers are very strict in this, particularly in this aspect. So I have to maintain that, right?
Okay. Okay.
I got the
So,
selection with so much difficulty. I don't want to lose any.
हेलो अस्सलाम वालेकुम मैम
Position.
हाँ आप ठीक है मैम हाँ शुक्र अल्लाह का आप बताइए हाँ 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 मैं जा रही हूँ
Please mute your mics.
हाँ हाँ कोई बात नहीं मैम बैठिए आप
do you have any low mood or depressed mood in last few weeks?
No, my mood is okay.
Okay. Do you have a good support at home?
Yes, support is okay. I'm quite happy with my partner.
Okay, thank you for your information give to me. Now come to your explanation about your condition. If we have no, actually, you know, we have this, if you come
Suzanne,
to...
bit loud, please. Please, bit loud and come close to the mic. I can't hear you exactly.
Okay. Actually, coming to your examination, now I want to examine you in presence of chaperone, if you allow me.
Okay.
And I will quick check to your tummy, and my nurse will take your observation.
Okay.
So now, Ashley, from your history you gave to me and your examination, that you have the secondary amenorrhea or stop menses, and maybe due to the more than one cause, but the most cause for that, or the most probably risk factor for you. This you have your weight to height ratio is lower than the normal. Okay.
Okay.
This lead to hormone disturbance in the brain. So this hormones is the protein coming from the brain to the ovaries to release the egg every month. If you look with me in this drawing, this is the brain, our brain, and this is the ovaries. And there is signal coming from the brain to the ovaries to work every month and release egg. This egg will continue and make our menses. So if the brain not probably, since this is signal, the ovary is not working good and no menses coming. So what we'll do for first you will
actually I'm not interested in all about these things. Can you please tell me that how I can get pregnant and how can I get periods? Because some of my friends have used some hormone pills and they say that with use of hormone pills we can have periods. So can you give me those?
Yeah, but we'll start to know what is the exact cause. We will do some investigation for you. Other hormones, we'll check the hormones to see what's the exact cause. Then your management will be under the management of multidisciplinary team of doctors containing my consultant and the endocrine or the hormone doctor and specialized nurse for that and your GP. We will start for this investigation. If you have imbalance in this, we will start to make lifestyle modification for your exercise and try to increase your weight. For that, I can connect you with the dietitian. He will help you to take a good diet but not lose more weight. After you finish your marathon or you will start this and you will get the normal weight, and according to this weight your hormones will start to resume as normal and your ovaries will start to work normal and menses will start. At this moment you can get pregnant if you have no other causes.
Yeah, but doctor, actually my tournament is in next 2 months. So you know that how difficult it was for me to have this place in the game. So I can't lose it. I have to go for that.
Yes, first of all, we check for
Can
your...
I go there? Can I participate in my next tournament, please?
Yes, but first we will check your hormone for pregnancy. If maybe you are pregnant, as you have no till 1 year out back, the first possibility you are pregnant. So we'll check for this. pregnancy, and we start to give you some pills to bring your menses and check your hormones also. During
Okay,
this
after
test, you
checking
can,
that I'm not pregnant, then you will give me pills, right?
yeah, we will
Okay.
start to your management plan to bring your menses. Okay.
Okay.
So I know I give you more information, so I will give you patient information leaflets about what we discussed, write back for your GP, and give you support group and contact number if you have any concern in bleeding in pain your tummy. So do you have any question?
I just want to reassure that how can I get pregnant? Like if my periods will start, so I will get pregnant myself, right?
I will. Yeah, I will. We will let you to start your
After
pregnancy.
2 months, I can participate in my tournament, right?
Sorry, if you
After
get
2 months,
pregnant,
I can participate in my tournament, right?
yes.
Okay, all right. Thank you.
Welcome. I will refer you also to the fertility clinic if you have not get pregnant normally. Okay.
Okay.
10 minutes up. 10 minutes up.
Okay, all right. Suzanne, you can
Thank you.
continue if you want to say something.
No, thank you.
Okay, thank you so much, Suzanne, for doing this station with me. So, Suzanne, how do you feel about this station? Have you done this before?
Yes, but I feel a little confused because no hormonal test here.
It was not hormonal test over here.
No other hormones. No other hormone test.
Yeah, no hormonal test over here. Suzanne, no problem in this. You actually did very well and you reached to the conclusion and the diagnosis exactly, right? Your approach to the station was exactly perfect, no doubt in that. Your communication is also excellent with the patient, like very humble, very polite, and very good in a just very empathetic manner, right? Your communication with colleague was also good, in which you involved multidisciplinary team. But Suzanne, actually, the things that need to improve, I will actually take the station from the very, very beginning to the end of the story, right? So that there will be no loophole left in the station after this. First of all, Suzanne, the good point in you is this: you picked the story immediately and you reached the diagnosis immediately that this is a case of elite sportswomen who is participating in the long distance runner, or in terms of she's involved in high impact training, right? So you know that ballet dancers or the long distance runner or women who are doing high impact trainings, they are at the higher risk of amenorrhea, right? So you reached the conclusion very rightly. You asked my concerns exactly on time, and even you addressed them immediately when I told you, when was telling you about my concern, you addressed them immediately. You have not postponed them that at later point in time I will tell you. So overall, you did station very well. But if you allow me, I just want to add few things more, right?
Yes, of course.
Yeah. So Suzanne, just take the station forward. First of all, you started the station by doing your introduction, then taking my introduction. Then you have done, I will tell you the special sequence. Please note down in your notebooks, right? Note down in your notebooks the students who have not already formulated their own plans in their mind. If you have already formulated, it's okay. But I will tell you my way, that how I used to do it, right? First of all, you will say that my name is Dr. Asma, or my name is Dr. Suzanne. I'm one of the doctor in the gynae clinic. May I confirm your name and age, please? You are Ashley Simon, 21 years. All right. Ashley, from this consultation, do you have any special expectations or your concerns? Okay, all right. So in this consultation, I will address all of your concerns, right? I will address all of your concerns. Together, we will formulate a management plan. Then I will document this discussion in the notes. I will give you patient information leaflet and I will write back to your GP. This is my way of doing this station, right? So that at the very beginning, I will kill many points in one line. 1, 2, 3, 4, 5. 5 points in a single line are done, right? No need to wastage of time. Secondly, when you did examination, you told me that I will do your examination, then I will feel for your tummy. If you allow me, in the presence of chaperone, nurse will do your observation. See, there is no need to waste your time, no need to give an opportunity to the role player so that she can get an opportunity to waste your time. Never allow her. How you can say this, that can I examine you in the presence of chaperone with your consent? I want to examine you in the presence of chaperone with your consent. That is it, right? It means you have already taken your consent. You have already involved the chaperone. You're not giving her, the ball is not her in her court, right? She's not the one who is going to waste your time now. You are the one. So basically take the control in your hand, not give in the role player's hand. Okay. So do not allow her to waste your time. Then coming to the information gathering. See, the information gathering is the easiest domain to get past and easiest domain to get fail if you're not taking it seriously. Because what we think is that in daily basis, we are taking the histories from the patient and we are taking information from the patient. It means we are knowing everything about patient. No, you know that information gathering domain can be passed very easily if you're exactly knowing. I have already told you in my last session as well, that two basic chunks of information gathering. One is to rule out the cause of the condition. Other is to rule out the complication that this condition is creating for the patient, right? So how you're going to ask, when did you start having your periods? Because early menarche or late menarche is associated with the elite athletes, right? This is their symptom, that they are having late menarches. Or when you have your last menstrual period, you asked very well, how long is your menstrual cycle? Are you presently taking any contraception or any hormones? Suzanne, if I'm not wrong, you have not asked me about contraception, right?
Yes, because she asking about in pregnancy.
Yeah, but probably she may be using in previously, because you can ask that what type of contraception she is using, right? Because hormone pills, if she is using, then story will be different, right? Barrier method, you can advise her that it will protect from the sexually shared infection in case she is not in relationship or she's single or she's like without any relationship and she's having multiple partners, right? So always, because contraception question is a part of your gynae questions, you can never miss it, right? Have you ever missed missed a period for a year or longer? If your BMI is less than 18.5, I will tell you that why 18.5 is so important figure. Do you worry about your weight? Have you ever had eating disorder, right? Because the belly dancers and the elite athlete sports, they are so much conscious about their weight, they actually develop bulimia or any other eating disorders, right? They are so much phobic about their eating habits. So eventually, sometime they develop eating disorders. Have you ever lost 5 kg in last 3 months? These all questions are not formulated by me. These all are the questions taken directly from the TOG article, which is basically the purpose of formulating this station, to have a grip and a strong knowledge about the patients who are having extreme low BMI in long impact training they are involved, or whatever sort of athletic activities they are doing, right? Then more than 5 kg, I will tell you that why this 5 kg, why this period missing 12 months is important, why this BMI is important. Because after taking this full history, you have to categorize the patient. There are actually 3 categories of the patient: who are athlete, who are having decreased BMI, who are having menstrual irregularity. According to those categories, then you will decide that whether you can allow the patient to go for the next tournament or not. You straightforwardly have given me permission that yes, I can go and participate in the tournament, right? I will tell you that what are these 3 categories. You have to do detailed assessment in the information gathering. After doing this assessment, you will be the person who will categorize the patient, that whether she is suitable for any kind of, I will tell you in the next few slides that what is exactly how the story of this station will unfold, right? Just stay in the information gathering. Please remember all these, each single question is the passing question of the information gathering. All these questions will make you 100% pass in the information gathering. Have you ever had stress fractures? It will also categorize her, because all these questions will change her category. This is the reason it is important to ask these questions. Have you ever experienced low bone density or osteoporosis? Osteoporosis, she probably not be knowing. Do you leak urine? You have not asked me any urogyne questions. These patients are always have eating disorders. These patients have always have urogyne problems. You should have asked me that whether I leak urine on coughing or not on coughing, while rushing to the toilet, urgency, and overactive bladder symptoms. All these are related with these patients. Have you ever had becoming pregnant because she is having a problem in getting pregnant? This is another story of these patients. Previous pregnancies, future fertility desires. All these questions, Suzanne, my dear, will make your information gathering 100% pass, right? And in this manner, in the agenda, 1, 2, 3, 4, 5, 6 points will be complete. An examination always ask in this manner, never leave any chance to the role player to waste a single moment of you. Your time is very important at that point in time. Not a single question should be missed, because each question is going to categorize this patient. You will asking these questions, and in your mind you will categorize this patient, because this is a recall station, but it's not 100% will be coming in the next exam. There can be a little bit twist or the change of the story, right? So next, what I have to do is this. What the condition patient is having, no doubt, you're absolutely right that patient is having secondary amenorrhea, right? But what is exactly we are suspecting that why she's having this? Why she's having this? Because she's suffering from a condition which is called relative energy deficiency in sports, right? Red S, relative energy deficiency in sport. This is a term which is called normal sufficient energy is required to maintain the normal body functions, which is called energy balance. Her expenditure is more as compared to her intake. This is the reason this condition, what was her name? Her name was Ashley. This condition, Ashley, can affect your bone health, your mental health, your periods, and even your ability to get pregnant. Tell her the condition she is having. Immediately tell her that along with this condition, these are the long-term risks that she's having. Any condition, polycystic ovarian syndrome, endometrial hyperplasia, or any condition, or PID, any condition which is associated with long-term sequels, always this is your passing marks of this station if you will not tell her long-term complications. If she has visited a healthcare professional, you have not told her the long-term healthcare, long-term sequels, she will go back and she will continue her activities. She will not be knowing that these are the consequences of her, all the activities that she's doing, right? So being a healthcare provider, this is our responsibility, and this is your passing score, right? What is the passing and what is the patient safety point in this station? I will tell you at the end, right? Then examination, what you're going to do. You have done BMI, right? Exactly, excellent. BMI is the first question you asked. I must appreciate, Suzanne, that you hit the target exactly on the point, right? BMI on the examination as well. Then vaginal examination, because these patients are hypoestrogenized, so there is vaginal atrophy. Along with that, you will do complete assessment of the patient. Either it should be done by GP, but this is your exam station, so maximum names as you can take, you should take in a very shorter way. Your annual screening is recommended to detect the earlier stage of this condition, right? What we can do is that incontinence questionnaire, right? Along with that, food diary, fitness log, right? Food diary to calculate that how much energy she's taking, fitness log so we can see that how many hours in a day she's spending on high impact exercises, right? So all this assessment is your responsibility to do the patient. Then coming her concerns, right? These are the investigations. If it has not been done, these are your responsibility to take the name of these. If amenorrhea of more than 6 months, then definitely UPT, and you passed patient safety when you discussed about the UPT, right? But I will tell you that where exactly the patient safety go down, right? Just in the management. Then you have to tell FSH, LH, prolactin, right? These are the gonadotropins that we have to check. Estradiol, these patients have all these hormones and estradiols are low. And then you have to tell AMH, because we want to see her ovarian reserves, right? That how her ovarian reserves are going. Bone scan and the pelvic scan, because sometimes they can put the story that DEXA scan has been done, and in the DEXA scan, the patient's bone density is getting low. This can also be the story, right? I will tell you the categories of the patients, and then we will be in better position to decide about this patient. Management plan, we will see just a minute. First of all, please, I know that it is not very clear. I have tried a lot to make it clear, but still it's not clear. But actually there are 3 categories of these types of patient, 1, 2, and 3. This is severe condition, this is moderate condition, this is mild condition, right? Mild condition means that any sort of patients who are participating in these athletic activities or the long distance trainer or the belly dancers, whoever she is, right? If she is having healthy eating habits, her appropriate energy reserves, healthy endocrine functions, like all hormonal profiles are normal, normal bone mineral density, normal musculoskeletal system, she can opt for full training and competition participation. This is basically all right. Sorry, someone is who is having some difficulty in caption. Okay. So this risk assessment tool is an important tool to categorize the patient, that whether she is in low risk, whether she is in moderate risk, or whether she is at the high risk group. These groups of the athletes or belly dancers or long impact distance trainers, all these can continue full training and competition participation. If your patient fall in this category, you can allow her that, yes, if she's, we are just keeping the fertility part aside, right? We're not discussing right with the fertility part. Apart from fertility desires, if she is fulfilling this criteria, you can allow her full training and competition participation. But if your patient falls here, and I was the patient who was in this category, right? Prolonged abnormality, low body fat, more than 5% weight loss. You have not asked me that whether I have lost weight in the last few months or not, right? Poor growth or development in adolescence, prolonged or severe low energy availability, amenorrhea 12 months, right? Delayed menarche more than 15 years. So I was the patient who fall in this category, right? Along with this, can train if following treatment plan. It means they can they can continue training if the treatment plan is being followed. May compete under supervision once medically cleared, not immediately. They can participate in competition once they will be medically cleared, once their treatment plan is being followed, not immediately going back from your clinic and she can participate in her regular activities, not like this. A big cross on this, right? These are the patients who are having eating disorders, who are having worse and severely bad condition, even severe electrocardiogram abnormalities as well. So these are no competition, no training. Your patient actually falls here. So you have to tell what.
Can I ask a question? When I ask her, she asked me,
Dr. Asma, can you repeat this point?
Yes, sure. I have actually not discussed the management right now. I was just discussing this assessment.
Yeah, ma'am, this point, how to simplify it.
Yes. See, just remember 2 to 3 points only from every box. No need to memorize all these boxes completely. This is the category they're always asking. Patient, this is the patient who is having more than 12 months amenorrhea. This is the patient who has lost 5% of the weight in the last few months, right? This is the patient who is having reduced bone mineral density or delayed menarche. So this will be the patient who is coming to you. This patient will never coming to you because she's fit enough to participate in full training and competition participation. There is no restriction for that. She is an athlete who is healthy enough, whose energy reserves are not getting low. She is not having any energy deficit. So she is not having any problem. She can participate fully in the program, right? These are the patients with you. So when she can start training, what you can say is that her name was Ashley. Ashley, once your treatment plan will be followed completely, and once you are cleared medically, fully fit and clear to participate in these activities, only then you will be allowed to participate, right? Keeping her pregnancy plans separate. I will tell you that what will be the answer of the fertility plans, right? So this is your category of the patient. These are
here she told me.
How do you recognize this category, ma'am?
She told me here.
Yeah, I have told you that my periods I have not had periods from last 12 months. This is written over here.
It's not clear, basically.
Ma'am, I want to ask a question.
Yeah, I have told you that it's not clear. But actually, the 3 big points which are written over here is that I will share it on the AlphaMed group, right? I will share that picture. Just a minute.
Ma'am, when she asked me after 2 months.
Please mute your mic. Yes, Suzanne, yes, please.
When I asked, she asked me to participate after 2 months. I told her we will start from now to bring your menses, and when your menses start, you can participate.
Excellent, Suzanne. Excellent. If you followed exactly this protocol, this is the reason I have told you that you hit the target exactly on the point, right? Just a minute. Let me give an opportunity so that I can discuss certain more important things. Now, coming to the Suzanne, its management plan. MDT and collaborative approach. What collaborative approach we should involve? Expert dietitian. You and me are not going to decide her diet plan, right? Because it will be a combination of the carbs and the protein in a specific proportion so that her dietary intake can be increased to 300 to 600 kilocalories per day. So the dietitian input is important. Specialist psychological input is important. This is the reason you have asked me that whether I am having any low mood or not, because this is also a complication of this condition. Her managers, coaches, physiotherapist, all these 5 members of the MDT are important to involve. Then treatment strategy, clearly tell her that treatment strategy is to increase the energy intake or to reduce your energy expenditures, right? Our target BMI, Ashley, is to reach at 18.5. This is the target BMI for these patients, right? And then clinical assessment tool will be used to guide the decision that whether your training will be continued or not. Based on the assessment and subsequent risk group, participation recommendation can vary from no competition in high risk group to full participation in low risk group, right? This is just for your information. This is not exactly that you have to speak to the patient. Now, these are the questions of the role player. I have to participate in championship in 3 months. Suzanne, you have done exactly correct thing that you have told me that first of all, my periods will be there and then I will be participating. But you know that athletes and elite sportswomen, they have actually scored and they have actually grabbed their seat with a lot of efforts and with struggle of many years and years. So you cannot stop them exactly. The only statement which will stop her this question, or the only statement which will put a stop on her desire is this, when you will say that this condition can have detrimental effect on your performance. Then she will never put a second question that when I am going to participate in the championship. Then she will be adamant that please correct my condition first, right? Otherwise she will again and again say that I want to participate, why I should not go for my championship, right? And this condition can have detrimental effect on your performance. It's not only it not only impact on your health, but also adversely affect your performance, because this condition is going to adversely affect her performance. This is basically the answer which will just keep her quiet and she will not repeat this question again. Right? Again, after assessment, further management will be, Suzanne, you have started me COCs, right?
I tell her to bring basis first and then start.
Suzanne, my dear, listen, actually, no COCs for these patients. See what COCs do actually. There is basically a hormone which is called insulin-like growth factor, right? IGF-1. Insulin-like growth factor. Insulin-like growth factor is a thing which actually cause more damage to the bones, and estrogen in the COCs, which basically stimulate insulin-like growth factor, which can cause, not stimulate, it down-regulate insulin growth factor, right? If we will give her COCs, these COCs will down-regulate insulin-like growth factor, right? Which is a bone trophic hormone, which conversely hinders the attainment of optimal bone mineral density. This is the reason that, and even we will give COCs, she will not having periods because of her condition. She will start having periods because of COCs. So COCs will hide her condition. COCs will be dangerous for her. So we are not going to give her COCs. We will say that first step is to restore your equal energy balance. This is the first step. After restoring her equal energy balance, after 12 months of the treatment, if her condition will not be optimized, if she is not having periods, even after 12 months, then only we can give her hormonal treatment, and that will be in the form of transdermal patch, not in the form of oral contraceptive pills, because oral contraceptive pills can downregulate certain growth factors which have bone trophic hormones or bone trophic effects. This is the reason no COC is recommended for these patients. 12-month conservative management with restoring equal energy balance. After 12 months, we can give her patch, right? Along with that, calcium 1500 milligrams per day. If she's having any urinary complaint, then you will take detailed history of urogynecology. Then you will offer her pelvic floor muscle training, bladder training, or even duloxetine can also be offered, right? I will tell you that what in this particular patient we have to say. If she will say, I'm planning for pregnancy, I have also asked from you, what are my options for fertility? what are her options for fertility, where she basically lands in the group of infertility, group 1, right? So first step is restore equal energy balance. Second step is ovulation induction using gonadotropins, because these are well tolerated, cost effective. After checking anti-doping UK agency, because she is doing high impact exercises, she is elite sportswoman. So after checking anti-doping UK agency, because all gonadotropins are safe according to anti-doping agency, but some, which is basically tamoxifen sort of things, these are prohibited by anti-doping agency, right? First of all, restoring equal energy balance. Second option, ovulation induction with gonadotropins. Third is, if ART attempted, then estrogen deficient patients will replace with estrogen, right? But this is not the thing to discuss with the patient. Limiting intensity of high impact training routine in a week after ovulation and avoiding high weight lifting in the first trimester, right? So this will be basically the management of this patient. We will start from here. We will start from the introduction, agenda, information gathering, and then starting her management plans. After explaining her situation and after telling her the long-term risk of this condition, then we will say that we will do your complete assessment, because this condition has a long-term effects on your health in terms of your bone health, mental health, periods, your urinary problem, not bowel problems, your water work problems can also be there. So we will do routine assessment of these types of patients, annual assessment by incontinence questionnaire, by giving food diary, menstrual diary, fitness log. After that, what we are going to do is that we will take the help and we will manage with the collaborative approach with a multidisciplinary team involving expert dietitian, specialist psychologist input, managers, coaches, physiotherapists. And our basic aim of the treatment strategy is to increase your energy intake or to reduce your energy expenditure, right? If you are not planning for the pregnancy, then we can allow you to go back to your training and to participate in your competition after once you're medically cleared and once your treatment plan has been started. But as now you are seeking for fertility, you are planning for the pregnancy. So for now, Ashley, it is very important for you to keep yourself an optimum BMI, restore equal energy balance, and we will start your ovulation induction once your optimum BMI is achieved, right? We will start your ovulation induction with a special medicine which are called gonadotropins, and we will check it with the anti-doping agency. After that, if it will not be successful, then we can involve the fertility specialist, because we have certain options of assisted reproductive techniques are also available. We can go for that as well, right? Otherwise, if she's not seeking for fertility, you can send her for the training, but she is seeking for the fertility. So there is no point in sending her back for the training, because if she will go back to the training, her energy expenditure will again be more than her energy intake, and she will never restore her normal menstruation. Normal hypothalamic pituitary ovarian axis will never be achieved. This is the reason that we have to take the station forward by telling her explanation, doing the examination and assessment, telling her these are the hormonal profile we want to do. This is the multidisciplinary team we are going to involve. This is our two aims: to attain optimum BMI and to attain optimum energy balance. This is our two aims to achieve with you. After the aims will be achieved, your periods will be restored. We will wait for 12 months. If your periods will not be restored after 12 months, then we can give you patch in the hormones in the form of patch, and along with the progestogens, along with calcium. And if any urinary problem, then pelvic floor muscle training, bladder training, and this is the options for getting her pregnant, right? Suzanne, is it clear, my dear, now?
Excuse me, ma'am.
Yes, 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 please.
Ma'am, is it like you have said, relative energy deficiency in force? Is it the same as anorexia nervosa?
No, 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 no. Anorexia nervosa is an eating disorder. Bulimia nervosa, anorexia nervosa, these are also the mechanism, and hypothalamic pituitary ovarian axis disturbance is same. But this mechanism is totally different, in a sense that hypothalamic pituitary ovarian axis all causing same dysfunction, right? But the cause of the dysfunction is different. Hypothalamic, this is exactly causing different dysfunction, right? Process is different, mechanism exactly same. But anorexia nervosa, bulimia nervosa, these are the eating disorders, right? The patient who is having anorexia nervosa may not be an athlete, right? She may be a regular person. She may be a school-going girl.
Ma'am, but this patient might also be eating less of this
Yes,
fat and
she can
carbohydrates.
be, because they are having multiple comorbidities along with this. She can have urinary problems, she can have psychological problems, she can have eating disorders as well. This is the reason I have entered over here. Have you ever had eating disorders? Right?
Is it appropriate to ask to the patient, like, are you having an eating disorder as such?
Yeah, no problem in that. Because we have to explore this. If you will not explore, how you are going to correct it? This
But
is the
then
point
this
of
is
patient safety.
it's like embarrassing
Offending.
the
You feel that
patient.
it's offending. No, it's
Yeah.
not offending at all.
And ma'am, why have you said about the patches of hormones? Why can't she take oral pills if she hasn't period for 1 year?
Yes, she cannot take oral pills because, just a minute, let me come to this point where it was. Yes. No COCs, because COCs will stimulate a protein or a hormone, which is insulin growth factor type of growth factor, right? It is not stimulated by patch. It is stimulated by oral form as well. Right?
Okay.
Not stimulation, actually down regulation, right? COCs down regulate insulin growth factor binding protein. Transdermal patch does not down regulate insulin growth factor. This is the reason if we will give her COCs, it will do two harms. First harm is that it will hide her features and she will start bleeding. She will become happy that I'm having regular menstruation, and her real condition will be masked. Second harm is that it will downregulate insulin growth factor, which is basically a bone trophic hormone. We do not want this thing. This is the reason patch is safe, COCs are not safe. But first
Okay.
conservative management, then medical management, right?
Yes.
Ma'am, has this station come in the exam?
Yes, my dear, this station has come in exam. I have already told you that I'm coming with new stations. Few
So
of my
sorry,
friends.
actually, I joined quite late, almost in
No
in
problem.
the
Recording will be
part.
with you, right? Don't worry at all.
Thank
Hello,
you.
Dr. Asma.
Who is there, Fatih?
Yes, ma'am. How are you?
Fatih,
It's
so
really,
long.
I miss you, ma'am.
Fatih, how about the station now? Just let me know.
Ma'am, I faced this station in this November exam. Same questions. And TFT were normal, amenorrhea of 12 months. And
No,
she was
how's the
asking,
station now?
ma'am, I didn't do even 10%. You
Yes.
told us. So that's why I failed.
No. Please, Fatima, don't say like this. I have already told you that you people are excellent in your preparation. See, without knowing anything, how perfectly Suzanne has reached exactly on the points, right? Only minor things were missing. So I have already told you that always you are not the reason behind it, right? Because in part 3, the perfect and the excellent guidance is most important. Because knowledge, everyone
Yeah.
is having same knowledge. But where any passing and the failing candidate is lacking actually is the guidance. If you have right guidance, there is no point in this that you can ever fail in this exam, right?
But Dr. Asma, everyone tells that part 2 and part 3, the knowledge is almost similar, but it's not the same actually. I mean, whatever we have read about REDs, like this anti-doping agencies, no COCP, these things we have never read actually, to be honest.
This is the reason I'm saying in part 2 guidance is not much important, because you have your guidelines available and you have to answer from those only. In part 3, the correct and the best guidance is most important thing to make your decision in the exam, right? It's not about you. Who is losing exam is not about you. Do not blame yourself, right? Stop blaming yourself that you are responsible for losing the exam. You are not the one. It's if you are having appropriate guidance, anyone can pass this exam. The only important thing is to have a good guidance, right? Okay, so friends, any question from this, or should I move to another bombardment station? Like it makes on next station is also very different.
Ma'am, next station,
Yeah, I
please. It
think
was
we
very
can next
awesome to
station,
hear.
yeah.
Okay, so my slide is changing or not? Because I want to give you a huge surprise. I have already told you, Sahitya is not here today, right? I have already told you that I love
Yes,
to give
ma'am.
surprises.
I think she is not here.
His slide is not changing, right?
No,
No.
ma'am.
Okay. Actually, what I think is that the people who have presented previous session in the last open session, if they can give the chance to their other friends as well, so it would be great. But it's your decision, mutual decision. Anyone who want to present, please.
I will love to.
Okay,
Ma'am,
okay.
may I?
Who is there, please? Tell me your name.
Aparna this side.
Aparna. All
Yeah.
right, Aparna, who is going to start the timer?
Ma'am, I can't see the next slide. It's a
Yeah, because I have paused the screen sharing so that I can bring out the station for you.
okay.
Just a minute. No, actually, I want very, very different station.
About the previous stations, can you tell or videos the share?
Just a minute.
Ma'am?
Sorry. Yeah, sorry. Come again. I can't hear you.
The previous session, is this available videos or no?
Yeah. It will be, the recording will be shared. You can have everything. No screenshots are off in my group. Everything you can share with you, your friends, anywhere. Right?
No.
Because what I
Where is
believe is
where
that
is the
spread
previous?
goodness and the goodness will comes to you.
So the videos present in the group?
I will upload this recording, my dear.
Ma'am, she's
Because
asking about the previous recording, previous session.
Yeah. Previous are also there in the group.
Okay,
Okay,
thank
I
you.
also
Side, I will tag. Who is this side?
Me, Suzanne.
Oh, Suzanne, definitely. I will tag you, my dear. Okay, so please,
Please,
anyone
ma'am,
start the
tag
timer?
with me also. Please, ma'am, tag me with also.
Okay, and who is this along with Suzanne?
Ma'am Sania. Ma'am
Okay.
Sania.
Please
Sanya,
me as well. Please tag me as well.
Okay, all right.
Ma'am, please resend again. Everyone will say tag me, tag me. Please resend again.
Okay. Just a minute. Let me. Actually, the next station is a bit complicated and full of controversies. So let me get ready myself as well. Just a minute, because I know you people are will have a lot of questions for that.